Today is March 6th, 6 days after my operation. So while I'm enjoying this beautiful view, I thought I should record some of my memory and experience I have in last 7 days. The first and foremost, this is not an experience anyone should have, and you should do everything to make sure you don't end up in this open heart surgery. It is extremely painful. It's a tough journey to go through, and by just maintaining the good lifestyle and diet, chance can be reduced a lot. But for others who has to come here, this video may give the idea how the surgery and recovery going to be.
Where are you? You're still scheduled to go. And for now, you're scheduled for 7 a.m. and your check-in time is 5 a.m. But we'll let you know if that changes. Well, all the positive vibes, you're in good hands, and we'll see you in the morning.
Yeah.
All right.
This is 3 o'clock in the morning. Just woke up. I just have to take a bath and leave for the hospital. So finally, this is the day. So this is 3:40 in the morning. Today is the day. So I'm about to leave now. So we are almost there. Probably in 5 minutes we'll be reaching to the hospital.
1,000 feet. You're about to enter the surgery. How do you feel?
I'm feeling quite actually nothing much. In fact, in the morning when I just wake up, that time for 2 seconds I fall. 2 seconds I fall kind of scared, but that's it. Yeah, it is not at all feeling like I'm going for a surgery. Yeah. It seems like I'm going for some trip. Yeah. In few hours, my life is going to change. Whole life. I cannot believe it. Okay, we reached. So again, we are early. I'm not at all scared. Still no feelings. Kind of like weird. I'm really thinking what is going on with me. Anyway, my surgery is going to be starting in few hours, and just hoping for the best. So Tuhi and Shoma is with me. Okay, so you want to give me a hug? So today I'm the lucky man, getting all the hugs and loves and everything. You know, life is a drama. You never know where the plot is going to take you. So see, today I'm here sitting with my family early in the morning, probably like 4:30, waiting for a life-changing event. Okay, they're calling my name, so I have to go. So my surgery date was 29th of February. Check-in time was 5 a.m. So I wake up little early, took a bath with special solution they have given, and started driving with my family. I reached there, did the check-in. The nurse took me inside and prepared me for the surgery. Asked some basic questions like what medicine I have taken earlier and some general questions. They prepared the IV line and shaved me from neck to toe. Soon after, the nurse who will be in the operating room explained what is going to be there in the surgery, any questions I might have. Few minutes later, anesthesiologist came and again gone through the entire process, asked me any question I had, and then kind of they said, okay, it is time to go to the surgery. I was trying to keep my good spirit up, trying to make fun with everyone, a little bit kidding around before going to the operating room. So my surgery started at 9:30. In the surgery room, when I went, there was 5% standing there. 3 of them I met earlier and 2 other people, but my surgeon was not there, and I wanted to have a conversation with him before going to the surgery. The surgery room is not very big, but it is full of lot of different medical equipments. When I entered in the room, I was making little fun. Just ask, oh, this is how your surgery room looks like. just to get little familiar with the people. But then they put me on a table. Table is probably 1 feet wide, attached to arm to it so that I can keep my arm on it. They prepared my wrist for the A-line. Then they put a mask on my face. Second later, my eyes become blurry, and then I'm totally gone. The surgery started at 9:30 and it took till 6:30 in the evening. So it went for 9 hours. Original plan for the surgery was 4 to 5 hours. It took longer because my surgeon decided to repair my valve instead of replacing it. And that is all I wanted from the beginning. But from all the echocardiological tests, the doctors thought that that is not going to be possible. But I'm so fortunate that I have my own valve, and I hope my valve is going to last for a long time. I don't remember much about anything what happened till next morning. I barely remember that after surgery, the first time I wake up, I was trying to breathe by myself, but because of the breathing tube, I was not able to, and asking for help. I remember the second time also I wake up and trying to breathe again, but I could not. I remember that time my wife and my daughter hold my hand. I even squeezed their hand just to show that I am doing okay.
Shona, are you okay? Shona?
Yeah, we're logged in. Okay, no way. Okay, so we're logged in.
Okay, take rest, Shona. I know a lot of pain. Can you put your thumbs up again? Yep. You're doing good.
I believe the very third time I was able to breathe by myself. And someone said, "Oh, you are breathing by yourself. We can take the tube out." They just took the tube out, and I was feeling so much better.
So his breathing tube is out now. So one thing at a time, which is good sign. You are now breathing by yourself, right?
The breathing tube is out. It was not that bad for maybe 5 seconds. Some pain, that's it. I am now breathing by myself. I have some little pain somewhere here. Hopefully it will go. Others are good. What I heard later is that my condition was very unstable, first 12 hours. And there was 4 persons, including doctors, monitoring me whole night and trying to stabilize me. Because the surgery took 9 hours, which is really lot. The staff members over there are so amazing. They not only took care of myself, they also took care of my wife, who was also very fragile because it's a long day for her. They gave her all kind of comfort, bed, assurance, anything needed. It's amazing experience that way, the way the caregiver works. By noon, I was much better and more conscious. I remember seeing my wife, daughter, and my friend Nilesh standing there. I had some good conversation with them at that time. They asked me to stand and sit on a chair, and I felt twice. When I was standing, my whole body is shaking. Because of the weakness.
Yeah. Well, I mean, you did pretty well. That's a couple steps towards me. To the right. To the right. Okay,
but later, in the third time in the evening, I was able to go and sit on a chair. That was a huge achievement, and one of the most difficult one.
Do you want to share how you feel?
I'm feeling actually okay. I was feeling much better. Right now I am getting pain again, but otherwise pretty normal. But I am extremely weak. So when I stand up, my whole body was shaking. So very weak, which is also normal. I'm supposed to, because of the medicine and the surgery. But that day I was very tired and sleepy because all the medications has given to me. So most of the day I was sleeping. The post-op 2 was really brutal to me. I was very low in energy the lowest point possible. I can feel all the pain. There are 4 tubes which are thicker than my fingers are inserted to me, and I have no appetite. I could not even keep the apple juice inside me. I had no energy to talk to anyone. I got a lot of painkiller that day. I know that they gave me opioid, oxy, of course other medicines. I was connected with so many machines and wire and the tubes. I cannot even move.
Here from Shogun, how is he doing?
Yeah, day 3. I'm feeling a little better now, but in the morning I was really feeling low energy. And now I think it's improving. It's getting better. Maybe I have seen Shoma, so I'm feeling okay. Yeah.
There's a little space. I'm trying to make my room. It's day 3 and this is his fast meal. So he's having chicken broth.
I had some chicken broth, but I had of course no appetite that time.
Do you need help, Shana?
But I promised myself I will be better next time. I realized that my wife is very exhausted and she needs to go and take rest. So in the evening I asked her to go back home, take rest and come back, because the caregiver over there are extremely kind and helpful. So I'll be in good hand anyway.
It's day 3 after his surgery. It's in the morning, it's around 7 a.m. and then I was with him overnight. It's extremely weak, but trying his best to kind of do better.
The next day, post-op 3. So I get up, went to the chair in the morning, took my breakfast, which was oatmeal and some berries, had my tea.
I'm trying to be feeling better today. So pushing myself to eat some food. I guess that's all I need also.
So you're having oatmeal and then fruit couples.
So on day 3, they decided to take all the 4 tubes out. They also took 2 wires going to the heart. They took also the A line, which going all the way from my neck to the heart.
This is the whole thing? It was inside?
Yeah, it's starting like right here to the rest of the way.
Which actually check the heart's function, blood pressure, and the rhythm. After moving all the tubes and the wires and the catheter, it felt much better. I am feeling a lot lighter now.
Okay, so now he has just only one thing in the neck. So hopefully tomorrow they will take that one out as well. So then you are good.
Yeah.
Right? Then you will be fine.
Getting back to normal.
Yeah, then you can walk and do better.
The tubes which are going inside my chest gave me a lot of discomfort. Actually, most of the discomfort I felt from the tube only, because these tubes are inside my chest and they are actually touching all the organs, maybe my lung, and every breath I take, I feel the pain. Breathing was so difficult for me. But they give a lot of medication and painkillers as needed. I was trying to avoid as much possible. From day 3, I don't think I had any oxy anymore, just the Tylenols.
But still good, right?
You like your food?
Yeah.
Okay.
For day 4, I have a lot bigger goal. I have to start walking. My appetite is back. I had my breakfast, and about 11 o'clock, I went for my first walk.
Alright, let's do a little bit.
My paperwork. I want to do that. Excellent. So now.
Good job, Shona.
Oh yeah, blood pressure looks stellar. Yeah. Okay, good. All right, I'll see you at the end of your lap.
Initially, it was really hard and exhausting. Still, I took probably 2 laps before going back to the bed. So things about the pain. Luckily, I had very little pain. Maybe little bit pain here in the insertion, but not really that much. But most of the pain I got is from the tube inserted in my chest, because that is very discomforting. It goes and touches all the organs like the lung, and every breath I take, I can feel the pain. That was not fun. In fact, from day 3, I had no oxy or strong painkiller. Even I wanted to avoid the Tylenols. So pain was not a big problem for me. On day 5th, I was feeling much better. My appetite is totally back. I am feeling a lot stronger. And doctor thinks that on paper everything looks okay. So they decided to move me to the recovery room. And from there, maybe by next day, which is tomorrow, they are going to let me go home. The experience I have surgery will be different from person to person. But this is kind of my experience, and it is going to give some idea how the surgery and the recovery is going to be. The entire system is very sophisticated. They are taking bloods every hour first few days. In the morning they will do the X-ray of the chest. There are multiple live monitors checking different way of the heart functions, and all the informations are going in a central location, and someone is making decision how to adjust the medicine, and based on that nurses are coming back and giving the medication, and entire thing is really
These machines are connected to the IV drips, and they each have their own liquids. So this is epinephrine, and right now 17 milligrams is being on. Amiodarone is on. IDF maintenance is on. Insulin is off, and this one is nitroglycerin. This one is also on. And then on that side is IDF maintenance is the only thing that's on, in potassium/IVF, which is potassium chloride. See, the bags with insulin are covered with that because they need to be protected from light. Same with epinephrine. Over here, that container is collecting the blood from his chest, and then the green one is the oxygen, and then the yellow one is the medical air. So he has 1 oxygen pump and 1 medical air pump. And over here, these ones are collecting the blood from his heart, the thoracic drainage. So it tells you the levels. These 3 of them, so you can see the blood in those pipes. All these 3 are measuring how much blood there is. And he also has a urine tube over there.
The surgery I had is huge, only because the knowledge and experience they have is helping someone to recover within a week. That's so amazing how the medical system works. For me, they adjusted magnesium, calcium, potassium, all those things based on the blood test in every hour. Sometimes glucose is going up and down. They are adjusting that too. It was a so well-designed process, very sophisticated, which probably came many years of understanding the medicine. So lung can hold a lot of fluid, which can give the pneumonia. And for that reason, there are some breathing exercises I'm supposed to do. So this one is just blowing. I have to do 10 times in every hour. And this is the one where I'm supposed to suck the air. Again, this one I'm supposed to do 10 times in every hour. Another thing you need to have is this pillow, because every time you sneeze or cough, lot of air build up inside the chest, which try to expand the rib cage, right? And that is going to give a lot of pain. So holding it tight before coughing or sneezing is going to help a lot. This is my breakfast. I already had probably 6 tablets from here, and I still have another 6 here. Today is day 6th. I am feeling much better. I had multiple rounds of walk yesterday, and most likely they are going to let me go. Only concern they have is my blood pressure is going up and down, and my feet is still a little bit puffy, but they will decide if I can go home today, and very likely I am going. But after going home, my actual recovery process will start, which means that I have to go for a walk a lot, and my distance of walk has to improve every day. Need to eat a lot of protein and other foods, which will help me to recover the surgery area, and I feel like within a month I'll be on my feet completely. So this is my chest.
Yeah.
You see that big cut. This is called what? Sternum.
Yeah. Yes.
And
so
here,
back.
yeah, here I had 4 tubes and 2 wires inserted. I guess today they are going to take it off. So that's my new mark, new painting on my chest.
Okay.
So this is how I feel.
Okay.
Ta-da! Yeah, the incision looks great.
So this one is supposed to kill all the bacteria.
Pretty much, yeah. It works very similarly to alcohol.
I had 4 tubes, but I have 3 holes. How
Well,
come?
maybe sometimes they branch and connect into one.
So my final thought is that this surgery is very difficult, but with time and care, things can go better. For me, it took 7 days to stand up and walk. I'm very confident that within a month, I'll be much better shape. And within 2 months, I should go back to normal, the state I was before. First few days will be the most difficult time, either because of lot of pain or extremely low energy because of all the medication and the big surgery. But only thing I can say is that this time will pass, because most of the day and time you will be sleeping. So the 7 days here gone very quickly, because more than half of the time I was sleeping. This is not an experience anyone should have. And by changing little bit lifestyle and dieting, chances of ending up here can be reduced a lot. So please, please, please make sure that look after your diet and exercise and health. This is the last place someone wants to come.